Hello everyone. So now we will start the topic of operations of head and neck. The first one is the primary surgical processing of wound in the head. Now, the processing of wound in the head, there are two types, which one is non-penetrating wound and penetrating wound. Non-penetrating wound is without damage to the dura mater, and penetrating wound is due to damage to the dura mater. Now, if there is a pointed blunt object injury, then displacement of lamina of the skull is taking place, and there are four types of displacement of lamina of the skull, like cracked, split, fragment, and pressure. Now, what is the aim of this surgical processing of wound in the head? To stop the bleeding, remove the foreign body, and prevent soft tissue infection. Now, there are two types, open and closed. So the procedure is, we need to shave the hair of the patient, we need to sterilize the wound, and then we need to put hydrogen peroxide for antibacterial purpose, and then we need to give anesthesia. After giving anesthesia, we need to cut the periphery of the wound. We would cut in the ellipsoid manner, which would be 0.3 to 0.5 centimeter. Now, bleeding would be stopped by, we should first finger press, then we should put a clamp, ligature or coagulant should be used, and then the soft tissue is retracted. After retracting the soft tissue, we remove the foreign body and we use the Luer's forceps to clean it. And then we do osteoplastic trepanation. What is osteoplastic trepanation? I would explain in the further topic, it is there. Then we do osteoplastic trepanation. And after cleaning the dura mater, then check the meningeal vessels. If we need to check the meningeal vessels, whether if it is damaged or not, if it is safe, then we don't have any issue. But if there is blue or dark red color, then there may be hematomas into it. Then we need to blood clots, we need to remove it and expose the subdural place, and we with physiological solutions. Now, after this procedure, the dura mater is stitched by thin ligature. Bone is done by cut gate suture. Galea aponeurotica by polymer thread, and skin by interrupted silk suture. Now, this was primary surgical processing of the wound in the head. Now we would move on to the trepanation of the skull. Now, there are two types of trepanations. One is decompressive and another is osteoplastic. Decompressive is also called as Cushing's, and osteoplastic is also called as Oliver Crone. Now, decompressive is a palliative operations. Now, this indication is increase in intracranial pressure, which leads to like if there is a tumor, then intracranial pressure would increase, or due to due to trauma, there would be edema in the brain. Now, what is the procedure of decompressive? Patient would lie on one side with the bent knees, like shoe-like dissection would be made on the temporal side of the bone. Base flap is opened till the zygomatic arch. Then temporal aponeurosis, interaponeurotic fat, and temporalis muscle is dissected vertically till the periosteum. Then separated with raspberry until 6 centimeter square. Okay. During the retracting, wound with hook. Then orifice with Duane's trepanator. The first we should use the sharp drill is applied, and the conical shape drill is used. Okay. Now, hole is wide, the hole which we are doing is widened with the Luer's cutter, and widening of this hole, which is it should not be anterior posterior. Anterior posterior is dangerous due to damage of the middle meningeal artery. And if there is any damage, even if we are very very safe about it, even if it is damaged, then we should stitched by blanket sutures. Okay. Now, first we should do the lumbar puncture, which should not exceed more than 10 to 30 ml. After doing the lumbar puncture, we should do dura mater is opened with cross-linked dissection. Now, the size of trepanation orifice, it depends on the intracranial pressure. Okay. Now, after doing all these things, operative dissection is sutured by layer, and except dura mater is not done. Now, this is decompressive trepanation. Now, what is osteoplastic trepanation? Osteoplastic trepanation, if there is a bleeding of middle meningeal artery or a hematoma or a tumor, then osteoplastic trepanation is done. Now, during this trepanation, a shoe-like dissection is made with the base of flap on zygomatic arch, same. But dissection of the skin, aponeurosis, periosteum and osteal flap is done in 3 stages. Okay, what are those stages? The first stage is the skin, subcutaneous tissue, aponeurosis and muscles are dissected. Base of flap is not more greater than 6 to 7 centimeter. Okay, then from 1 centimeter from the eye socket and tragus of ear, it is cut. Okay, then cutenomusculo-aponeurotic flap is pulled downward after bleeding is stopped. This is the first stage. Now, second stage, osteoperiosteal flap is dissected 1 centimeter upward, and 5 to 7 openings are made with trepanator. Now, in this 5 openings, giggle saw is introduced. Okay, which would be 45 degree. Okay, it is sawn at the angle of 45 degree. This is the second stage. And on the third stage, surface of dura mater is cleaned, hematoma is removed, arteries and branches are ligated with the thin silk suture. Now, this was about osteoplastic treponema. And then wound is sutured layered by layered. Now, these were the trepanations of skull, decompressive and osteoplastic. Now, next is antrotomy, which is mastoidotomy. Now, trepanation on mastoidotomy, how it is done? Mastoid process. Indication is if there is mastoiditis and enteritis. What would be the complication? The complication of purulent inflammation in the middle ear. Okay. What is the aim? Aim is to remove the purulent exudation, granulation and drainage of the antrum mastoidium. What are the special instruments? We need to remember the special instruments, which is Voyachik surgical set, gauge and chisels, and bulbous end probe. Okay. What is the procedure of this mastoidotomy? Now, patient is in supine position. After that, turn his head on unaffected area and ear is retracted anteriorly. Then we need to give general anesthesia or local anesthesia, which is 0.5% of Novocaine. Skin with subcutaneous tissue is dissected. How much? 1 centimeter from the auricle. Periosteum and tissues are cut and Shippo's triangle is exposed. Then periosteum is retracted with the raspberry and outer layer is removed with grooved gauge. Then antrum mastoidium is exposed, pus and granulation is removed with Folksman spoon. And then drainage is done and skin is sutured. Now, one thing remember, from henceforth, and antrotomy, just remember the special instrument, it would come in next operation also. And remember this Folksman spoon also. To remove the pus and granulation, it would come in the next operation also. So, fronto and maxillary sinotomy. Now, this fronto and maxillary sinusotomy is done when inflammation of frontal sinus or inflammation of the maxillary sinus, which is also called as hygue mortis. See, here also special instrument is Voyachik surgical set of gauge and chisels. Now, we need to give anesthesia by per os or per enteral. Local anesthesia by per os or per enteral. There are two methods, central, peripheral. Centrally, if injection of Novocaine solution near foramen rotundum, and peripherally near tuber maxillae near infraorbital region artery. Now, Ritter-Jason's frontotomy. Arc-shaped dissection is made where base of the nose and supraorbital margin of the soft tissue. Okay. Then superior medial wall of the orbital cavity is made. In this cavity, the hole is made by watches and cheslils. Then we need to remove the pus by Folksman spoon and skin is stitched. Next is maxillary sinusotomy, which is also called as hyomartotomy. In this, the anterior wall of maxilla is trepanated. Upper lip is lifted. Dissection from invasive second to third upper molar is done. Hole in the bone is done by Wojcik's cutter. Sinus is cleared by physiological solution and Folksman spoon is used to remove the pus. Now, main thing, do not damage infraorbital foramen as trigeminal nerve and orbital artery is situated. So, before moving to this incision of purulent processes on the lateral region of the face, I want to tell you one thing. In the given book, there is one topic called as phlegmons. There is nothing to teach in that. You just need to go through that phlegmons. So I'm skipping that topic, but you please go through that topic of phlegmons. Incision of purulent process on the lateral regions of the face. Now, indication is purulent process of the fatty spaces. How to do that? We need to do incision under the facial nerve from external acoustic meatus to temporal region. Along what? Zygomatic arch to nose to commissure of lips and angle of mandible. So, after that, Wojniacki, he gave a process. Now, purulent process of retromandibular region. Then incision of the skin and fascia near the angle of mandible. Then cervical branch of the facial nerve may be damaged. Next is purulent process of the neck, parotitis. There would be transverse incision from inferior margin of the lobule of the ear to the angle of the mouth. Next is purulent process of parapharyngeal fatty spaces with corpus addisum buccae. Here we need to do incision of 2 to 3 cm from ala nasal to 4 to 5 cm from lobule of the ear. Now, in this process, incision of mucous membrane of the buccal maxillary fold is better. Means from inside the buccal cavity. Last is the temporal region purulent process. In this, incision from the zygomatic process of the frontal bone to the lobule of the ear is done. It was a very short process. It is not that much hard. So please go through all these topics. All those topics, and next topic I would post. So please keep studying, keep watching. Thank you.